Good morning, everyone. I'm Anthony Crowell, the Dean and President here at New York Law School, and it is my great pleasure to welcome you to our, I believe it is the 109th City Law Breakfast. Ross always likes to remind us of the numbers. And I remembered 108 because Bloomberg is the 108th mayor, so hopefully I'll remember when we're at 110. In any event, I know that it was probably a bit of a challenge for a number of you to get here this morning in light of recent events in the city, which I think is a very interesting frame for this morning's breakfast, which focuses on public health and features Health Commissioner Dr. Tom Farley. And I can tell you that from my years in city government, that the health department is one of the most important and powerful agencies in the city of New York, often not recognized for the breadth and scope of its work and just how many lives it touches all at once. It's both a regulator and a service provider all at once with vast, vast powers and reach. And certainly through the Board of Health, which a quasi-legislative body, has enormous importance for our everyday lives in New York City. Now more than ever, in light of Hurricane Sandy, the health department will really have a tremendous amount of new work and important challenges to confront for all of us in the city. I'm very happy that Dr. Farley and his general counsel, Tom Merrill, and also Deputy General Counsel Roz Winholtz, who I've worked with very closely over the years. Tom and I actually had offices next to each other at the law department for a number of years. We are in good hands given their skills and talents and experience. I want to introduce Professor Ross Sandler, who runs the Center for New York City Law and has been a guiding force for these breakfasts, which are an important staple of our New York City civic dialogue. And for that, we are very grateful, Ross, for doing this now for 20 years. So without further ado, Professor Ross Sandler.
Thank you. Thank you. Thank you. I welcome everybody. And I want to say that in many ways, this is one of the more difficult times to hold one of these breakfasts. The city's gone through 2 weeks of very difficult times, and there are many people who are still without power, without water, and not just a few. So this is a time when we have to think not only how lucky we are that we're with power and water and subways now too, but there are many people in the city without. I also applaud all of you who've come. It's hard to get here on a Friday morning at 8 o'clock anyway, and I see a lot of loyal people who come and who are dedicated to work for the city and are very much actively involved with city affairs. So I thank you for being here and for loyally being here in a week that we were closed for half a day and ourselves. I also thank Dr. Farley for accepting. This is a hard week for him and hard 2 weeks. He, among his on his resume, he he was a professor at Tulane. His graduate degrees in medical medicine and public health are from Tulane, and he was part of the team that worked after Katrina in setting up as he told me earlier today, setting up the public health, or restoring the public health system in New Orleans after Katrina. So this is something that he knows a good bit about, and he's working very hard for us right now to take care of these things. He, a graduate of Haverford, as I said, Tulane, a medical degree in public health. He came to the city in 2007 to work for Tom Frieden, who also spoke at one of these breakfasts early on. And when he first came up here, when Tom Frieden went off to the CDC, then Dr. Farley became the commissioner. And this Department of Health in New York City, certainly in the Bloomberg administration, has been very aggressive on what I guess in corporate world called wellness issues. And those issues are now what marks the Bloomberg administration and the Department of Health as for its aggressiveness and its success in thinking about health far more broadly than epidemics and disease. This is about all of our health, and he is the leader of it now, and a very important leader. We welcome you to New York Law School and to this microphone.
Thank you, and good morning. When I was asked to give this talk, I was happy to do it, not just because Anthony Crowell is a good guy who has helped me out a lot over the past few years, or not just because this is an important group, but also because I figured it'd be popular amongst a bunch of lawyers, because we keep our lawyers fully employed, not just in the health department, but throughout city government. I think Tom Merrill hopes that we're going to take it to the Supreme Court with some of our actions lately. As you'll see, we do stir up trouble, and we stir up trouble for what I consider to be really good reasons. I had planned this talk before the hurricane and wanted to just give you sort of a sampling of ways in which we've used policy to promote health in the Bloomberg administration. But I thought because of Hurricane Sandy, I'd talk just a little bit about what the health department is doing in this emergency before I get into that. So what do we do in the health department in emergencies? Well, first, what do we do in the health department in general? Our mission statement is pretty simple and very broad. We say that we're here to protect and promote the health of all New Yorkers, and really take that mandate broadly. That in emergencies, that means we are doing a lot of planning in advance to say what the city should do to protect ourselves from emergencies and to respond to them quickly. Before and during and after emergencies, we're very much involved in gathering data, turning it into useful information, making recommendations as to how to channel resources and recommendations about what decisions to make to best protect the health of people during the emergency. And then we fill in gaps where there are health needs out there and there's nobody else to do it. We will sometimes go into that gap. So specifically, what we're doing for Hurricane Sandy is we're out there monitoring the health implications of that. We have a surveillance system, as we call it, where we get data from hospital emergency departments every day about the patients that they saw the previous 24 hours. And so it's a massive amount of data, and we go through and pull out data from the text, and we can get a sense of trends. So I can tell you now that at this hurricane, most of our health problems now are about the same as they are pre-hurricane, but we did have a spike in the first day or two afterwards of people who needed methadone and couldn't get their methadone, or people who needed dialysis and couldn't get their dialysis. And we currently are higher than usual the number of people coming to emergency departments asking for medicines that was spoiled in the storm or that they lost and need a refill for. So we can sort of have a finger on the pulse of the health of the population through that. We're out there providing advice to prevent health problems, so telling people to use their generators carefully, because we know people in previous hurricanes will have carbon monoxide poisoning by running their generators indoors, and that can be a major cause of death after some hurricanes. And we talk about food safety and water safety, various other environmental health hazards. And we've been very much involved working with the state health department on trying to evacuate people from healthcare facilities pre or post-storm to protect loss of life from this during hurricane and healthcare facilities. And we have done a variety of things to fill in gaps. So we have deployed our staff to our shelters. We have 8 special medical needs shelters where people who have some sort of chronic illness and couldn't stay in their homes are staying right now. We are deploying staff to these different sort of recovery assistance centers in the most hard-hit areas. And we're also right now deploying our restaurant inspectors to do something other than just put a letter grade out front, but to tell restaurants that have lost power for a few days how to reopen in a safe way so that the food that was spoiled doesn't make people sick. So that's just some of the things that we're doing right now. So now let me just move on to how we have used policy to promote health through the administration. We don't take on every health risk, but we do set priorities for health risks. And our priorities are based on what we think is killing the most people. We think that smoking is the #1 preventable cause of death in New York City, so we put a lot of energy on smoking. And I would say the single most important thing we've done on smoking, period, is our Smoke-Free Air Acts. And the first one was passed in 2002. That prohibited smoking in indoor workplaces, including restaurants and bars. This was very far-reaching at the time, really, I wouldn't say revolutionary because it had been passed in California, but we were the first city to do it, and very controversial. And the stated reason for that was to protect workers from secondhand smoke. But it was realized at the time, and has subsequently played out, that it had a much broader impact than that. What it did was really change the whole social norm around smoking. After this law was passed, it no longer became acceptable to light up a cigarette in an indoor place. If someone were to light up one here now, despite the fact that we have a bunch of lawyers in the room, people would be shocked, not because it's against the law, but just because it's not done. It's considered in poor taste. And that has caused an awful lot of people to quit. So it's had a huge impact on overall smoking rates. In 2011, we extended that to parks and beaches. And what we're seeing now is organizations putting in place policies to extend smoke-free air. So CUNY, for example, is going this year to total tobacco-free campuses citywide. Very big impact. And another important policy we've done in smoking is raise cigarette taxes. So in 2002, there was a law passed and require action both in Albany and here in the City Council to raise tax in New York City on a pack of cigarettes by $1.50 per pack. Before that time, if you look in 2000, the total tax per pack of cigarettes was about $1.50. So that raised it to $3.30. There have been subsequent increases both at the state and federal level. So now the total tax on a pack of cigarettes in New York City is $6.86. So that means, for those of you who are not smokers, and I hope that's almost all of you, and if you don't know this, if you go down to a bodega and you buy a pack of cigarettes, it's going to cost you about $11. And that's the highest price you're going to pay in the country. And that's great, because in particular, it helps young people who tend to have very little disposable cash not pick up smoking in the first place, but also helps induce smokers to quit. Now here's a policy that we passed through the Board of Health that we think has great potential, but it ran into some legal problems. In 2009, at the recommendation of the Health Department, the Board of Health passed a rule requiring that any tobacco retailer post a warning sign designed by the Health Department to warn that potential purchasers about the risks of smoking. And so this was our first prototype, our first attempt at what a warning sign would look like. The rule was passed by the Board of Health. So the idea is that right now there's warnings on a pack of cigarettes, and there soon will be graphic warnings on a pack of cigarettes, but you don't see that until you buy a pack of cigarettes. And so we wanted to warn people before they bought that pack of cigarettes and to counteract some of the advertising that's present at all tobacco retailers. Tobacco companies sued us. We lost in district court. They said that the rule was preempted by the federal law, which is the Federal Cigarette Labeling and Advertising Act. And they said because, and I'm going to get in over my head here on the legal aspect of this, because we tied them to the promotion of cigarettes, that that was an area that was carved out under federal law, and so the local government couldn't do that. We appealed, we lost. However, within the ruling, the federal court recognized that there was authority of the local government to regulate the time, place, and manner of cigarette promotional activity. So we do think that there is some opportunity within there for policies to further have some impact on the retail promotion, sale of cigarettes. And we think that there is potential. When the rule was in place, before the courts invalidated it, we did an evaluation of it. And what you're looking at here is data from before the rules went in place, before the signs went up, to after the signs went up, where we surveyed customers who were exiting a store that either did not beforehand or did afterwards have a warning sign up there. And we asked them, did you notice the sign? Did it make you, what did it make you think? Did it make you think that you might want to quit? Did it make you not purchase the cigarettes? And you can see from baseline to follow-up, there was a big increase in percentage of people who said that they saw a sign that warned them about their health risks of smoking. An increase in the percentage of people said that it helped them consider quitting and helped them think about the health risks. It did not cause people to not purchase cigarettes on that occasion. But we do think that it had an impact on people at least considering quitting smoking. So we thought for a low-cost and fairly simple operation, this had great potential. So I do think that there are maybe opportunities for us to do something at the retail level to reduce the amount of promotion that you currently see around smoking, and that would have an impact on cigarette purchasing and use. Okay, enough with smoking. Let me move on now to some other policies we've done, mainly around food. So this is around trans fat. First of all, what is trans fat? Trans fat is really an artificial chemical. It was first invented and first produced in factories in the early 1900s as a cheaper alternative to butter, which also had some advantages in industrial food processing. It was not designed for health purposes. What they do is they take corn oil or some other vegetable oil, and they heat it to a few thousand degrees, and with a chemical reaction they change its nature so that it becomes solid at room temperature and so that it doesn't burn when you cook it. That process is called partial hydrogenation, and it causes things called partially hydrogenated vegetable oil, PHVO. That's what trans fat is. Was used for a century, and it was only in the last 20 years or so that studies came out that showed that consuming this stuff increases your bad cholesterol, your LDL, it reduces your good cholesterol, and it overall increases your risk of heart disease or stroke in a pretty substantial amount. So the amount of trans fat that's in a typical order of French fries, 4 grams a day, if you eat that every day, your heart attack risk increases by about 25%. So pretty substantial. And one advantage of this from a health and legal perspective is that this stuff is totally unnecessary. This is an artificial chemical introduced into the food supply, and so we could simply, unlike say saturated fat, which is bad for your health but is in natural products all over the place, and so we could simply say you can't use it, and there are many substitutes available. Now the food industry argued that the substitutes were unworkable, unnecessary, difficult to find, whatever, but we didn't think so. So in 2006 the Board of Health approved a rule that simply said that restaurants, which are regulated by the Board of Health, cannot use trans fats. There were some exceptions. If they buy a muffin in a package from a manufacturer and then in turn sell that, that can have trans fats in it, but they can't cook with trans fats. It was phased in over 18 months, and despite the fact that there were threats that we were sued, we were never sued on this. And in short order, more than 90% of restaurants were in compliance, and now our restaurants are essentially trans fat free, and we've recently done a study that shows that people's trans fat consumption in New York City when they go to restaurants is down substantially without it being substituted by saturated fat. So this has really been a big success from our perspective. It wasn't always a big success from the press. People considered this draconian government overreach. How could you consider such a thing? It's still like this in much of the rest of the country. There are a few places that have followed our lead and banned trans fat. A few cities here that you see, Philadelphia, Boston, et cetera, and I think the entire state of California. But most of the rest of the country is still using trans fats. There are some few restaurant chains that have said they're not using it. But it's certainly, it's a artificial chemical, doesn't belong in the food supply. We need to just get rid of it from my perspective. Okay, calorie labeling. This is another policy we put in place. What's the purpose, what's the rationale for this? We know from various studies that consumers are terrible at estimating how many calories there are in a food item that are given to them. That their guesses are way off, and they tend to be way off on the low side. So they may underestimate by about a half how many calories are in a chicken fajitas. People have really tough sense estimating a volume of something that's handed to them, in part because the plates are getting larger and people see it relative to the plate size. And also you can't estimate what's the fat content of a food item, and the calorie content is very much dependent upon the fat content. Even trained dietitians, it's been shown in studies, don't even come anywhere near close and be able to estimate the calorie count of a food item given to them. So since many people are counting calories, since many people want to lose weight or not gain weight, we think that there's value to letting people see a number of how many calories are in an item. So here's sort of the policy background of this. In 1989, the federal government passed what's called the National Nutritional Labeling and Education Act. That's what put the nutrition facts panels on packaged food. So when you buy food in the grocery store, you see that nutrition facts panel. That came out of that rule. That federal law specifically exempted restaurants, and it left up to the states or localities what they wanted to do on restaurants. So in 2006, the Health Department proposed and the Board of Health passed a rule that required restaurants to post not the entire nutrition facts of a restaurant item, but just the calories. And the rule was limited to chain restaurants, which we felt had the wherewithal and the standardization in order to know the calorie counts of their items. We were sued by the New York State Restaurant Association. We lost. We changed the rule based upon what was in the judge's ruling, passed it under the Board of Health again. We were sued again, and we won ultimately. And so the calorie counts have gone up here in New York City. And then in 2009, Congressman Waxman liked the idea, and so when healthcare reform was being considered in Washington, he inserted that into the federal healthcare, Federal Affordable Care Act. And so it is now law in the United States for chain restaurants to have calorie counts posted. The FDA has yet to promulgate rules on this. They've been slow in doing that. I hope that they get them done soon, and then soon you'll see calorie counts on chain restaurants nationwide. What good does it do? We have evaluated calorie counts here in New York City ourselves, and a few other people have done studies. What we found was that about 15% of customers say that they use the calorie counts in determining what to purchase, and those who do purchase about 100 calories less. That effect varied by restaurant chain. We did this across about a dozen restaurant chains. And we found, interestingly, well, we did this as a pre-post study. In Subway, from pre to post, calorie consumption went up. And we scratched our heads and thought, why is that? And then we discovered between pre and post, they started their $5 footlong promotion. And the percentage of customers who went from buying a half a sandwich to a full sandwich increased dramatically. So we learned there that this effect, that there's a value to this calorie count. Some people use it. Those who use it purchase a little less, not a lot less, but that it can be overwhelmed by marketing of the restaurants. Other studies that were done, Starbucks, there was a group of researchers at Stanford that got data from Starbucks cash registers. So they could look at millions of transactions. And they found that on average people purchased about 6% fewer calories. And those who were buying a whole meal at Starbucks, which is not the whole, not your average customer, they were buying about 250 calories less. So overall conclusion I'd say is that the calorie counts work a little bit, that they are a contributor to the overall response to the obesity epidemic, but by themselves they're not going to turn this epidemic around. This is only one piece to the solution. Sugary drinks. We have had a lot of attention on this lately, I think for good reasons. There is a lot of sugar in drinks, by the way, and the drinks are getting larger, as you can see on the far right there. That's a half gallon that you can get at KFC. It has about 800 calories. Why are we focusing on this? Well, calorie intake from sugary drinks have increased dramatically over the last 30 years, nearly tripling. So people here consuming about 190 calories, that's per capita per day, in the form of sugary drinks. If that amount is added to your diet without you changing anything else, on average, you can calculate that means you'll gain 15 pounds in a year. That's a lot. And the problem is that sugary drinks appear to get just added to your diet. There are studies that show that they're not filling, and so people don't tend to compensate for those added calories by eating less calories at that meal or a subsequent meal. So there's something distinct about just these large amounts of sugar water, which is a major contributor to the obesity epidemic. It's not the entire epidemic. Maybe a third of it or something like that can be attributed to this, but it's a lot. Here in New York City, just to give you some sense of this, one day I said, sort of threw together this graph. This is where I'm graphing on the x-axis here is across different neighborhoods in New York City, the percent of adults who say they're drinking sugary drinks. The y-axis is the percent of adults who are obese. And each data point there is a neighborhood, and according to the symbol, you can see what borough it's in. So the message here is, regardless of what borough you're in, regardless of what socioeconomic status the population is in, there's a pretty strong connection between how much sugary drinks people consume and how overweight they are. Pretty remarkably tight regression here. So when you combine this with the rest of the literature on sugary drinks, it suggests that here in New York City even, that this sugary drinks are a major contributor to the problem. So what have we done on sugary drinks to try to address that? We want people to reduce their consumption. We don't want to ban them, but we want to figure out how, in some way, to reverse the sort of arms race that is producing larger and larger portions and more consumption. So we first proposed an excise tax on sugary drinks of 1 cent per ounce. And the rationale for that is that means the larger portion you buy, the more you pay. So it reverses the kind of volume-based discounting incentive that you get right now. And it also encourages people to switch to diet drinks if you're only taxing the sugary drinks. That went nowhere in the New York State legislature. It was buried under lobbying by the soda industry. We then proposed a rule that would prohibit the use of food stamp benefits, now actually called Supplemental Nutrition Assistance Program benefits, or SNAP benefits, to purchase sugary drinks. Already, if you're on the food stamp program, there are many things that you cannot use your food stamp benefits for. You can't use them to buy alcohol or tobacco or pet food or prepared food. So you can't buy a rotisserie chicken with your food stamps. We said, well, since this is, after all, a supplemental nutrition assistance program, we don't think that we should be subsidizing the purchase of what is probably the worst contributor to a nutritional problem in America today. So let's just add one more item to that list of things that you can't use your food stamp benefits for. And then if people want to buy that item, they still can with their own cash. And most people on food stamps are not living entirely on food stamps. It's a supplemental program, so they can still purchase those with their own cash. We had to propose this as a 2-year demonstration project to the USDA because we can't change the policy under existing federal law, but there is this opportunity for a demonstration project. But it needs to be approved by the USDA. The USDA denied it, so didn't succeed there. And then the third thing we tried on sugary drinks is, as you heard recently, our portion cap. What's the rationale for the portion cap? First is this issue of the massive portion sizes. This is just a sample to demonstrate the problem here. When McDonald's opened in 1955, they had one size sugary drink and it was 7 ounces. All right? It increased over time to where it peaked in the early 2000s where you had 2 sizes, a 32 ounce and a 42 ounce. All right? So almost 5 times larger than when it started in 1955. Since that time, McDonald's has shrunk their portion sizes a little bit. And right now, you can get the smallest size is 12 ounces, and that's labeled a child size. So now twice the size of what used to be normal for an adult is now considered for a child. And so most people, most big he-men, are not going to go into McDonald's and say, give me a child-size soda. So they go in and they get the default size, which is going to be 21 or 32 ounces. So we're still a lot larger than what we were 30 years ago or 50 years ago. And I got to tell you, I remember going to McDonald's in the 1960s, and nobody at that time felt like they were starving or dying of dehydration because the drinks were too small. You know, life went on. We survived with that. So if we were to go down to smaller sizes, that would probably help the obesity epidemic a lot, and people wouldn't suffer. So the way the portion rule worked was that it was proposed by the Health Department, passed by the Board of Health. It simply sets a maximum size for the portions sold of sugary drinks in restaurants, which are regulated by the Health Department. And it applies to any of these drinks that are basically sugar water, which is what the research really suggests are causing the problem. Excludes diet beverages, it excludes things like unsweetened coffee and tea, excludes dairy drink, excludes alcoholic drinks. And if people want more than 16 ounces, they can get it. So it's really a cap on the container size. It's not a cap on what people can drink. It's not a cap on what people can sell. That's really a container regulation. Nonetheless, it's been presented as the trans fat ban was, as heavy-handed overreach of government, but it enables people still the freedom of choice while giving some sense of what would be an appropriate portion size. So it's gotten a lot of attention. If you didn't see that, I love this ad. And I think the attention itself has been a really good thing. This has been probably our best free earned media that we've ever had. I was totally surprised by how much attention this rule got. And so now everybody knows that there's an obesity risk to sugary drinks. That's a good thing. Now the rule itself is important. I want to make sure this rule becomes reality, but the education itself is valuable. Overall, we're having some success with sugary drinks. We do annual surveys of both adults and teenagers and ask them about their sugar drink consumption. And now they may be increasingly dishonest over time, or maybe we're winning, but we are seeing reductions in the percentage of people, adults and teenagers, who say they drink these drinks over the last few years. Okay, last one I want to mention is our Green Card initiative. We know we have a health problem and that people would be a lot healthier if they ate more fruits and vegetables. We also know it can be tough, particularly in low-income neighborhoods, to find good, fresh fruits and vegetables. In New York City, there is you can sell food on the street as a mobile vendor, but there's a cap on the total number of mobile food vendors in the city. And so, at our encouragement, the law was passed by the City Council that raised the cap on the number of mobile food vendors, but only if they sold fresh fruits and vegetables, and only if they sold them in neighborhoods where we had high rates of obesity and diabetes that were basically your poor, underserved neighborhoods. So I thought this was a very clever rule. I didn't come up with the idea, others did, but I thought it was a very clever rule because it increased access to fruits and vegetables without the city having to put any of its own dollars into it. We just changed the rules and let the market fill in there. The law enabled 1,000 more permits to be issued for these. About 500 have been issued, which means it's not everyone has become a cart. in order for people to do this, they've got to be able to make a living selling fresh fruits and vegetables in very poor neighborhoods, in the South Bronx or in Queens. That's a lot harder than to sell fruits and vegetables in Times Square. And so it's tough. Many of these guys have not made it, but some of them have. And so you can go to poor neighborhoods and you can go on the street and you can find some great fruits and vegetables because of that. And interestingly, we have some evaluation data that said where we evaluated not just the green carts, but also the brick and mortar stores in these poor neighborhoods. And we're seeing increases in the fruits and vegetables in the brick and mortar stores. And maybe it's a coincidence, but I'm suspicious that the bodegas are seeing competition from that guy down the street, and so they're putting some fruits and vegetables in their stores as well, which would be great. And I can't say cause and effect here, but I can say that our tracking surveys are showing increase in consumption of fruits and vegetables over the last couple of years in the percentage of people who say they had 5 or more, or the percentage of people who say they didn't, or in a reduction in the percentage of people who said they didn't have any. So something is working, something is making progress, at least by self-report, in fruits and vegetables. So overall, our food policies we think are good. They have been controversial. If you were to read the New York Post, you would think that we are widely hated. But in fact, if you look at polls, you see that people like it. This is a poll done by Quinnipiac where they asked people to think that the mayor's food policies were about right, whether they were too much, whether not enough. So 55% said it was not about right, and 17% said we hadn't gone far enough. So overall, 80% of people, they pretty much like what we're doing, and you see the comment below. So I guess the larger message is, first of all, if we want to deal with those health problems that affect a lot of people, those are mass diseases. That means we need mass remedies. And you do that through policy change, especially at a time when our budgets are shrinking. We can't really do a program to really help people be healthy, so we do it through policy change. And we've been able to find a few little areas within local law, within the Board of Health rules, where we can change policies that really change our world in ways which really promote health. And we're going to continue to do that. And I'd say we've been able to do that because we have a mayor who's willing to stick his neck out and take the kind of criticism that we get for this. But when we do that, it really has a huge benefit. So I'm excited to be here, and particularly excited that I have a bunch of lawyers who will help me out of trouble when I get into it. So let me stop there and open up for questions.
You come up and there are questions to the microphone, but I'm going to just ask one question. First, this is enormously innovative, what you and the administration have done. It really is exciting and quite wonderful. But traditionally, we always thought about the schools, the lunch programs and the exercise and recess. What role do you play with that?
We work with the Department of Education to have the schools be health promoting. So we have improved the nutritional quality of school food a lot over the past few years. We are also increasing the amount of physical activity time in schools. But I'll have to say this, when people think about health promotion, they always say, let's go into schools, take care of kids, with the assumption that us adults, you can kind of write off. We're too late, you know, we're hopeless. My opinion is we can promote the health of adults as well, and we all live together with children, and so if we create a healthier food environment, we're going to all benefit. So we don't limit our efforts to schools. And I should say, I'm going to take a few questions, and then, because I've got stuff for the hurricane I've got to respond to, I'm going to duck out and then turn it over to Tom Merrill to answer other questions. Yes.
I'd like to ask a question about an area that you did not discuss, sex. Specifically, do you have any evidence?
I'm for it.
Do you have any medical evidence that the policy decisions of Mayors Giuliani and Bloomberg to close establishments like gay bathhouses resulted in different health outcomes in New York City than in cities which pursued other strategies?
You know, I looked into the history of that, and there's a lot of fighting over that time about the closure of bathhouses, and they were closed in a sense, but they actually they were never totally closed. There were a number of bathhouses that stayed open, and to the extent that they closed, it tended to be more because the market changed, because a lot of the gay men didn't want to go to bathhouses when there was this horror of the AIDS epidemic. So they never totally closed. Everything changed at the same time. Sexual habits changed, fear changed, and so it's very hard to unravel what effect whatever policies were done in different cities had on transmission of HIV. So that there's a lot of people say, oh, well, this happened and it didn't work, or this happened and it did work. I think nobody can really say for sure what impact the different policies had on HIV transmission.
First, just a quick comment. My son worked at a movie theater in New Jersey in the summer. Their small size of soda was like 30 ounces. So many customers were either A, confused, they said, no, I didn't order the large, but it was a small, or B, commented that Mayor Bloomberg wouldn't like this. It was a regular joke in New Jersey.
Right.
Okay, but separately, I was wondering the question, what is the connection legally between the Board of Health and Department of Health, and could they theoretically be merged into one agency? And also, what about tax on alcohol? That's not particularly good for you either. Thank
Right.
you.
So I'm going to answer this on Board of Health, and Tom's going to bail me out, as usual, if I say something wrong. The Board of Health is a quasi-legislative body separate from the Health Department that, excuse me? It sits within? Okay. That can pass rules that have the force of law within a certain limited area of health. The Board of Health, but they simply pass the policies. They don't implement them. They don't enforce them. The Health Department is responsible for implementing and enforcing any policies that the Board of Health passes. The Board of Health members, unlike the way it's been presented in the press, are independent members. They're not political hacks. They all have to be medical experts. About half of them have to be MDs. And they serve they're nominated by the mayor, appointed with the consent of the council, and they serve a fixed term. So they can't be fired if they do something the mayor doesn't like. And so they are truly independent health experts. They don't necessarily do what the health department wants them to do. But anyway, so they have the policy enacting role, and the health department has the role of implementing and enforcing. Yes.
Hi. I run a foster care agency in Queens, so I've been in the business for a long time. Have you done any kind of focus groups where the change is generated by the people whose health is affected rather than doing top-down? I know there's a lot of backlash against all four of the things you're doing, but there's a lot of backlash when somebody in authority sets rules and people rebel.
Yeah, we do a lot of focus groups in various forms and for various ways. Certainly, we do a lot of media messaging, and so most of our focus groups are done in the context of that, to understand how people feel about a certain product or certain behavior or certain message, and we shape our messages based upon that. There are other focus groups who would just get a sense for how people feel about things. I do think it's important to be in touch with the opinions of people that you affect. On the other hand, I also think that it's times when it's important to lead and to do things that even will have some people upset. It has to be done carefully. And then I'll say this, although most of our policies have taken a lot of criticism, in my 3+ years as health commissioner, no one has yet come up to me and said, please put trans fat back in my food. No one has yet come up to me and said, please put secondhand smoke back in my restaurants. So that when you change the world in a way that makes it easier for people to be healthy, people like it. And so a certain amount of community discomfort is something that we are used to. And we do it very carefully, and I think our track record shows in ways which enable people to have their freedoms while still be healthier.
Okay, thank you.
That's a good place to stop. Dr. Farley has to go on to do other things right now. I'm sorry, we're going to let him go, and the city, and don't leave so fast, though. As we always do, we like to present to our speakers a product of the scholarship of this law school, and this is by my colleague James Simon. It's a book about FDR and Chief Justice Hughes. Don't know what the health implications are, but I do want to present it to you. And thanks for coming today on a week that really has been a struggle for all of us in the city. Thank you so much.
Yeah, just to be clear, I just do want to introduce then Tom Merrill, my general counsel, who has been involved in all of these issues from before my time as well as after my time, and he will be able to answer every one of your questions totally accurately.
And I've been given carte blanche to do so. All right.
Thank you for coming.
So
You want to ask a question, then I want to ask a question also, so go ahead.
Actually, I prefer to speak to the general counsel. I find that the lawyers of departments know more than the commissioners. Well,
I'm glad Tom heard that as he was walking out.
that's okay, but he is a good physician, and I think that's fine. But I apologize on behalf of Andrew Cuomo. I apologize for being late. It's his MTA that kept a number of us delayed. However, the question is, I understand that the commissioner touched on package labeling, and although it may be a federal requirement, I wondered if he knew, or if do you know, and I'm asking this for myself and on behalf of Linda Beth Rosenthal, why is it that kosher foods that are sold, commercially and so forth, seem not to have the nutritional labeling that everything else does? Is there some exemption that you would be impinging on their freedom of religion?
I mean, I've never heard that. I wasn't aware of that. Roz, do you know? If there is an exemption, would you found
Is there anyone who keeps kosher and buys that stuff?
Yeah.
Like Zomic bread,
I think
things like that.
it may come, there are certain exceptions to the federal labeling requirements that are found in the NLEA. My suspicion is it's not all kosher food, but there may be certain subtypes of kosher food that fall within those exceptions. It's been a while since.
Are the regulations based on volume of production?
No, it may be who's producing, or if it's prepared food. Prepared food, for instance, is exempted. Some of the other carve-outs, I mean, it's we're going back 4 years to the litigation. I haven't looked at the NLEA or the FDA regs, which are rather laborious in a while. But I don't, like I said, I don't believe all kosher foods are exempt, but there may be subsets of kosher foods that fall within those exemptions to the federal labeling requirements.
And those foods,
but there's nothing
non-kosher would be required. to have
Right, the same type of food by the same manufacturer. There's nothing specific in the NLEA that says because you're kosher, you're exempt from federal labeling requirements.
I would submit that health concerns trump that issue.
Okay.
Thank
I
you.
agree.
The commissioner alluded to the sugary drinks being a significant factor contributing to the obesity problem, but he didn't talk more broadly about what the other factors are. Does the department have a position on, or a formula for how to attack the obesity problem?
Well, I don't think there's one silver bullet that's going to end the obesity problem. In the litigation that's going on currently, I mean, we don't disagree. Whatever you do in obesity, when we did calorie labeling, the response is that's not going to solve it. When we did soda, the answer is that's not going to solve it. We agree that it's a multifactorial problem. It basically comes down to a calculus: calories in or exceeding calories out. And everyone today is less active than they were in the past, and people are consuming more calories than they were in the past. So it's going to take a lot of things to solve obesity. As Tom said earlier, probably the biggest impact of calorie labeling was that it put the discussion, no pun intended, on the table, and people started talking about it and focusing on it. But that itself's not the cure, and soda is a big driver, and tackling it is important. But you also have to do the other things, and we are involved in the schools, and we do have play streets and things like that to get kids active and to burn more calories. But people are more sedate than they were in the past, and they're eating more calories from a lot of different sources.
No serious effort, though, to increase physical education in the schools?
Absolutely. I mean, that is something the department supports, and by tackling soda, we're not saying at the same time, not to do that. But I will point out this: I don't know if you saw our media campaigns, but there was the one with the guy. We had it was the same guy who was drinking the sugar in the other earlier ones. But the last one was made the point that to burn off one soda, you essentially have to walk from Times Square to Brooklyn. It's a 3-mile walk to burn 200 calories. So, yeah, we can increase physical activity, but if you think that having kids run around for a little bit is going to solve it, it's not. As long as kids are drinking soda, as long as kids are eating more, and as long as me as Tom's the big thin guy that doesn't need this. I'm the fat guy we write the rules for, and as long as I'm drinking soda and eating Snickers bars, going to the gym for 45 minutes is not going to be the solution either.
I wonder if you would give us some indication of the various litigations that are going on where they stand.
Well, coincidentally, we have one going on today. So I'm going to start in the president. I'm going to start in the president and work backwards, and then Trevor and I have to run out because Trevor Lippman in the law department is working on it. But most recently, we were sued over. We were sued over the portion cap rule. And Article 78 was brought by the Beverage Association and some other. It's always the industry plaintiff that's the big one, but they always bring in the local plaintiffs too. But there was an Article 78 filed back in October. Our papers were actually due last week, but the hurricane happened and the Supreme Court shut down, and we're actually filing today. So one of the things I had to touch base with Tom on is later in the day we have to get him to sign an affirmation to submit in that case. But the claim in the most recent litigation is a separation of powers claim. I don't know if people are familiar with Boreali versus Axelrod, but that's a case that was a Court of Appeals case back from 1987 that deals with what are the limits, if there are limits, on the delegated authority of a quasi-legislative board like the Board of Health. And so the soda industry has challenged the portion cap rule, arguing that we've stepped over that authority and that this should have been done by a legislature. And in fact, yesterday there was an amicus submitted by not all of the council, but 5 of the council members. So I think, as I said, we're going to be going back and filing our papers today, but this is clearly an issue that we anticipated. This is one that we feel, strongly on, and tracing the history of the Board of Health back to 1866 when it was created by the state legislature, because the local government at the time wasn't acting to the health threat at the time, which was cholera back then. We feel that this does fit squarely within the board's authority. Simultaneously, Tom didn't mention this one, but we have another litigation going on right now which deals with ritual circumcision. I'll just mention that because I predict that if I do get to the Supreme Court, as he's promised me, that'll be the one that gets me there. It doesn't really relate to food. There was also another initiative that he didn't talk about, which resulted in litigation, and I want to mention it because we were in the Second Circuit, or the law department was in the Second Circuit last week on it. We were there, actually it was this week, it was on Election Day. In 2010, I believe, the City Council, with our support and our input, passed a law that restricted the sale of flavored tobacco products other than cigarettes. The federal government has prohibited the sale of flavored cigarettes other than menthol, but left open the regulation of flavored these chews and these pipe tobaccos and other tobacco cigars that are now coming out and are flavored with such things as chocolate and vanilla and pina colada. And there's some, the suspicion is that these are products that are geared towards kids. I don't think most cigar smokers smoke chocolate cigars, but or bubblegum cigars. But these products have, been developed as opportunities for the tobacco industry to get kids hooked on nicotine has disappeared in other areas. And so the City Council passed a law that said basically in New York City you cannot sell products other than menthol, tobacco products other than cigarettes that are flavored. As always, we were sued in that case by U.S. Tobacco, which is a manufacturer of cigars and cigarillos. And the claims in the district court were preemption and commerce clause and due process. They moved for an injunction only on preemption, and were unsuccessful. They later then discontinued the Commerce Clause arguments. I suspect because they would have opened the door to discovery on the burden we were imposing on them, but that disappeared. And they moved for summary judgment, knowing that they were going to lose in the district court because they had lost on the preemption on the injunctive motion, and did, and then took it up. We're always trying to tee the case up for the Second Circuit. We had argument on Tuesday, and the argument, and again, it was under preemption. And Tom alluded to FICLA, which is what we lost our other litigation on. FICLA is a very preemptive statute. I say my dream, the Federal Cigarette Labeling and Advertising Act. Whenever I speak, I say to people, my dream job when I leave this is I want to go teach high school or junior high social studies, and I'm going to make every kid read FICLA, because it really tells you all you need to know about Congress. It starts, in its intent language. It talks first paragraph, cigarettes are really bad for you. We got to do something about them. But the second paragraph is but they're really good for the economy. And so FICLA sets out this, FICLA is the law that put this warning, Surgeon General warning on the cigarette packs. But at the same time, it put off very preemptive language, again, because cigarettes are important for the economy, that restrict localities and states from imposing any requirement based on health that relates in any way to the promotion or advertising of cigarettes. And the door opened up a little bit in 2009 when President Obama passed the, and I always get the acronym, I'm horrible with acronyms, but it's the Family Smoking Prevention Tobacco Control Act, FSBTCA, which eased preemption in a couple different ways. It was in reaction to a case called Lorillard, where before, back in the 90s, there was this argument whether the states still had the freedom to regulate time, place, and manner of advertising. Lorillard said they didn't, that FICLA was so preemptive they couldn't do that. And so the FSBTCA came along and it eased that. And the other thing it did is it changed preemption in some other areas, one being that we're preempted from, it also gave the FDA the authority to regulate tobacco, which was in response to another case, Brown and Williamson. Back in the 1990s, President Clinton tried to regulate tobacco. He gave the FDA authority, and one of the most clever legal arguments of all time, the tobacco industry said, well, you can't, the FDA can't regulate us. That's beyond the authority of the FDCA, because that's only authorizes the FDA to regulate products that can be safe, and our products can never be safe. So, and they succeeded in that. So the FSPTCA came along to fix those problems, and it gave new authority to localities to, among other things, do time, place, and manner. And that was the language in the sign case that Tom quoted. That was in response to the FSPTCA. But the other thing it did is it clarified that localities can regulate the sale, which we've always been able to do. But it put new language in. But you can't regulate a product standard. Only the FDA can do that under the new law. So when we passed, or the City Council passed the flavored ban, the industry sued under preemption, saying that what you're really doing is you're regulating a product standard, because the flavoring comes from probably not real chocolate, but some chemical that gives tobacco chocolate flavor. And we said that we were regulating the sale. And going into the argument, I thought it could go either way. But the Second Circuit was incredibly receptive to the city's position, incredibly hostile to the tobacco industry. And it was Judge Lynch, Judge Radji, and Judge Newman, and they seemed to think that this new language in the statute even gives localities the authority to go broad enough to even ban completely the sale of cigarettes within their locality. They rejected this idea that banning a product was regulating a tobacco standard. That they kind of accepted that if you're defining a tobacco product, you are in essence talking about constituents, but to the extent that you're not saying how much nicotine or what chemical has to be in a cigarette, you're free under the language to say what can be sold and not sold in your jurisdiction. So again, this was just the argument, and argument is always like reading tea leaves, but something very good could come out of this. If the decision follows the argument, there could be a very important decision, basically reaffirming the rights of states and localities right now to go so far as to control what tobacco products are sold in their jurisdictions. And this actually would be a very important decision in tobacco control, so we're anxiously awaiting that. Tom mentioned,
This last week always ended at 9:30.
Okay, I'm sorry. Well, we had a lot of litigation, so the sign case we did lose. That also was preemption. We were sued by Lorillard, RJR, and all the other big tobacco companies, along with a couple bodegas. But the claim there was First Amendment preemption and Boreali. We lost on preemption again, because there was the issue there was we said that we were citing our ability to regulate sale. We were saying that retailers, city licensed retailers, and we should be able to say that as a retailer you got to put a warning sign up. I still think that as a basic police power, we should be able to say to a retailer, you've got to put cessation information up. But the court said no, that these again are warnings related health warnings that are related to promotion because they're near the point of promotion. And promotion is very broad. It means not just those signs, the Marlboro signs, but the actual display of the packs. And so that's why we lost that case. Tom mentioned that pack warnings are, may soon have graphic warnings on them. I should correct him to, there's that's actually being litigated separately right now, and the D.C. Circuit just recently enjoined the FDA's implementation of pack warnings because they didn't have preemption, but they got to the First Amendment issue, which is also present whenever you're talking about requiring a warning like that. And the D.C. Circuit, which conflicts with the Sixth Circuit, the decision earlier in the year, basically found that requiring these graphic warnings like that is a compelled speech issue that violates the First Amendment, and that's a case I actually think will go up to the Supreme Court next year because it is the FDA and it's in conflict with the Sixth Amendment. But it's something we will only have graphic pack warnings if the Supreme Court turns that around. And then if we have 2 minutes for calorie labeling. As Tom said, we were sued twice in that case. Originally, so the NLEA, we did calorie labeling under that open hole in the NLEA. 1989, the Restaurant Association ran to Congress and said, "Don't make us post calories." So that left. There's a very complicated preemption provision in the NLEA, which basically says if you're not covered, then you're not preempted. Unfortunately, the NLEA, in addition to putting nutrition pact panels on food, it also gave the FDA greater authority to regulate what's called health nutrition claims. At that time, people were saying my food is less caloric, it's healthy, all these types of claims, and Congress wanted to give the FDA the authority to regulate nutrition claims. So the NLEA covered that, and it covered it for restaurants as well. There's preemption if you're regulating a nutrition content claim. Very complicated FDA regulations, but the statement 100 calories is the nutrient content claim. So the restaurants, the State Restaurant Association's claim was that we were in effect regulating nutrient content claims and preempted under that part of the act. In the first litigation, the way we had structured the law originally, it was based on a restaurant's voluntary provision of calorie information. If McDonald's put on its website that our burger has 400 calories, they were then, and the theory for that was, well, you have the information, so you might as well put it at the point of sale. But that voluntary statement is a nutrient content claim, and we were preempted from regulating it. So the court found preemption, but it noted that if it were a mandate, if it weren't a voluntary claim, we would be free to require it. And so in response to Judge Howell's decision, we went back and refashioned the law and made it any chain that's 15 or more. The federal law is 20 or more, so it's a little different, but and that will be coming, probably regs will be coming out soon. And Judge Howell then affirmed it, and that's how we got to calorie labeling in New York. And I say one of my adversaries here. How you doing?
Well, I'm very happy you gave us that rundown of the litigation. I must say I had no idea the Department of Health was so engrossed in litigation. I want to thank you for stepping in like this, Tom. It was really helpful, and I thank you all. I'd like to give him a hand too, and wish you good luck on your litigation. And thank you all for coming. We will see you in January. Thank you.